James is a healthy 6-year-old, and he's being seen today for his well child visit via telehealth. Mom says he's doing well, but he really misses his friends and misses going to school every day. He currently goes 3 days a week, every other week, and is using the iPad on his virtual school days. Mom says the activities are engaging, but it's a struggle some days. She knows he's watching a lot more screen time on this device. Due to the pandemic and social distancing, cold weather and snow, he doesn't go out and play much. They live in an apartment, and mom says, until I can get the vaccine, I just don't want him being around a lot of other people. What advice can we offer James and his mom today? Is there any health risk regard to watching a screen as much as James is? Hi, this is Frank Domino, and joining me today is Susan Feeney, Doctor of Nurse Practitioners and the Director of the Nurse Practitioner Tracks at the University of Massachusetts Medical School's Graduate School of Nursing. Good morning, Susan.
Good morning, Frank.
We all are on screens
Uh,
all the time. Can you
Problem.
talk a little bit about the association between school closings and the development of myopia in school age children?
Yes, so it turns out it's not a direct effect by the pandemic. In other words, the COVID virus doesn't cause changes to the eye regarding this. It's really how we have accommodated for this pandemic. So there appears to be a correlation between kids being home, confined, also not being in a classroom, and the development and the increase of myopia, especially in school age kids, 6, 7, and 8, is where we're seeing this more. And um, you think about what a 6-year-old would normally be doing pre-pandemic. They'd be in class, and if you think they're sitting at a desk, they do some close work, but they're looking up at the blackboard, they're interacting with their friends, they're running around outside. And so their vision is going from near to far, and that's accommodation is happening all day long. But now that that type of accommodation, that type of change in their near to far vision has really been restricted. And even if they're going to school a couple days a week, the majority of their time is being looking closely at a screen. So this has really had an impact. Um, and, you know, hopefully we'll see a change in this soon. But there definitely has been an uptick in myopia in this age group. And I think also across the board, all ages.
Well, I think even before the pandemic began, the addictive nature of screens was well recognized both in children and adults.
Right.
But now the pandemic has just put a real magnifying glass on this problem. What's the recent evidence about the influence of pandemic related behavior on children's vision?
Well, there was a study out of China that came out this year, and it basically they have been doing pretty intensive refractory type of evaluation on children across the board from I think school age through adolescence for the last 5 years. And what they saw starting in, you know, that associated with the pandemic. So January through like October of this year, they saw an incredible increase in myopia and the kids that were in, which they all were in home confinement. And in China, they had a pretty significant confinement as well. It was fairly across the board, and they were basically in their homes from January to May. And what they found was in 6-year-olds, a 400% increase in myopia, and they saw like a 100 or 200% increase in 7-year-olds and a 40% in 8-year-olds. And they felt that this was totally associated with this home confinement and online courses for all the things we just talked about. The fact is, that's a fundamental change for this age group. They're used to being in class and looking and having a change in their vision from near to far and not being so focused on a screen. So that was really an alarm bell. And I think it threw a real alarm through the whole across the world, especially with ophthalmologists, that this is something we really need to address.
Well, I mean, these numbers are quite high and
Yeah.
they're disturbing. Do we have any idea what the short and long term effects of all this screen time might be on children's vision?
Well, what we know about myopia is that the more severe the myopia is in the earlier the onset, it has a significant correlation with poor vision outcomes as people age. So we know that that children who develop myopia, significant myopia in childhood, often go on to develop really sight-threatening complications like retinal degeneration, glaucoma, and retinal detachment because it changes the sphere of the eye. So, and when does this usually come about is when they go into the working world. So, if this truly is something that's happening and may not be reversible, what does this mean for vision of this group of kids as they age? So it's something we need to really be aware of because this is not this there are some poor outcomes that are associated with significant myopia when children develop it at that age.
All right, so we've got a fairly important pandemic-related problem that
Right.
can have a lifetime of impact. Um, what are we going to tell James and his mom today?
Well, I did want to mention about why it impacts these kids, this age group. When they look across the full age range of children, they really saw this significance in this age group versus teenagers. And what they said was this really wasn't a change for teenagers, right? They were already sitting and watching, looking at a screen. That the behavior wasn't changing. But there is some theory that a child at 6 has a very vulnerable eye, if you will, and more vulnerable to those environmental triggers to develop myopia. Um, so I thought that was an interesting theory anyway. So it seems to really be impacting this. So I think what I would say to James's mother was, you know, I think we're at a point now where if you can get him outside and playing, um, you know, using social distancing, using a mask, getting him outside to play, structuring screen time so that you really are limiting it as much as you can. And that we also need to be checking his acuity. We can't just assume since we have to do telehealth that we can't be assessing this. And I would be, um, you know, very apt to refer if I had a kid with signs of decreased acuity, um, and to send them for evaluation.
I think those last 2 points are very important. First is that we probably need to do visual acuity as a routine part of their annual exam, and maybe even more frequently
Mm.
um, as a screening tool while we're suffering school closure, partial or fully. And then the second is just long term. Um, my experience with 5 and 6 year olds are they're pretty good at following directions. So, um, encouraging them as well as their parents to find other activities. If your eyes are starting to get tired, it means you've spent too much time looking at the screen.
Right,
And so let's think right now. Think of 1 or 2 things you can do when your eyes get tired, so we can give them a break from the phone or from the computer screen or the tablet that would be just as much fun, if even not more fun,
right.
um, and not necessarily drive the parents any crazier. So
Or
thank you, Susan.
and I think even using some kind of timer to say, okay, it's been 40 minutes now. Let's step away. Let's do something else. I know one more burden for the but for the parents. But this is I think this is a red flag that's coming that we really can't ignore.
Well, I agree, and thank you. I think this raises our awareness as well, and quite personally, we all need to be looking at less screens, and so I'm going to take this to heart. Thank you again.
My pleasure. Thank you.
Practice pointer. Include visual acuity assessment in all your school age children and counsel your children and parents about limiting screen time and its potential for long term visual dysfunction. Join us next time when we investigate prolonged shoulder pain and the diagnosis of impingement syndrome and adhesive capsulitis.